I am called Kellen Nyamrunji, a research associate based at Makerere University. Tobacco is the most preventable cause of death, and specifically to the African region, 13 million women use tobacco products. We see 22,000 women who die every year from tobacco-related diseases which are preventable in Africa. This statistic is worrying, and therefore, as we celebrate the African Women's Day, my vision for tobacco control in Africa is to prevent the youth from starting to use, offer help to quit, and stop secondhand smoke exposure.
I'm Bettina Edziwa. I'm working with the African Capacity Building Foundation based in Harare. The future that I envision is to see a tobacco control actor or civil society organization or staff fully capacitated in tobacco control issues, for whether be for advocacy, whether be for research, whether be for tobacco industry monitoring. Because without this capacity, without these resources, whether be financial, knowledge resources, we will not be able to counteract, especially the tobacco industry influence. We will not be able to advocate for the implementation of the tobacco control laws in Africa.
Celine Award. I work at the International Institute for Legislative Affairs. I lead the team there. In the next 5 years, I think my vision for tobacco control in Africa would be to see, strengthen tobacco control policy framework in the continent and strengthen implementation, but more so also to see, governments in Africa really prioritizing tobacco control and making deliberate efforts to allocate resources.
Good morning, good afternoon, or good evening. My name is Raquel Majoque. I'm a medical doctor specialized in public health. I am currently a program officer for tobacco control and non-communicable diseases at the WHO Mozambique office. With an experience of more than 15 years in the field, which I do with great pride and zeal, building national capacity, advocating for the implementation of tobacco control policies in the country, and also making sure that future generations are healthier. But what would really be most satisfying for me would be to see the next generation free of this evil, free of this public health problem. It would be to see that no child has to drop out of school or stop studying, stop playing, to work in tobacco plantations or any other related area. It would be to see that no child loses his parents to tobacco-related diseases, cardiovascular diseases, hypertension, and so on. It would be to see that no child in the near future gives in to the misleading advertising in the tobacco industry marketing, that no child starts in tobacco consumption. It would be to see in Africa where children and teenagers can grow up healthy and deciding about their own future. Children who are able to decide and not give in to the misleading advertising of the tobacco industry, that maintain and take care of their health and not start smoking. That would be my dream. Thank you.
My name is Fatiduff. I'm the regional coordinator for the Framework Convention Alliance, the FCA. I hope that we will have a tobacco-free generation. I think that with the provision of the Framework Convention, with the support of governments, ministries, and civil society, we will get there.
I'm Harriet Namata, working with the Center for Tobacco Control in Africa as the Senior Program Officer in charge of programs and monitoring and evaluation. I hold a PhD in statistics and I worked with the Department of Mathematics. I'm now involved in research and monitoring and evaluation in the health sector. In tobacco control, my vision is to strengthen human capacity in doing what is right and just and fair through information generation, sharing, and use in order to contribute to a tobacco-free Africa.
My name is Naima Helen. I'm a tobacco control policy consultant and currently the director of the climate campaign for the Afro region with corporate accountability, and I'm based in Kampala, Uganda. I would like to see all countries in Africa enact and effectively implement a comprehensive WHO FCTC compliant tobacco control law with a clear section of the letter and spirit of Article 5.3 embedded within their laws. I'd also like to see the tobacco industry held accountable for the role of skyrocketing health costs, for the environmental damages, for human rights infractions all over Africa, especially in this COVID season.
My name is Hilda Ochefu. I work for the Campaign for Tobacco-Free Kids as the sub-regional coordinator, and I'm based in Abuja, Nigeria. So really important for our work, I think, is to mobilize the African youth. So we have millions of young people who can potentially add a lot of value to the work that's being done in the Africa region. And of course, these youth are the ones who are being primarily targeted by the tobacco industry. So it will be really awesome to mobilize them and get them into the campaign and make sure that they're part of this journey.
Hello, everybody. My name is Rachel Kitonyo Divotu. I come from Kenya, and I've been involved in tobacco control for 18 years. I've seen tobacco control in Africa growing, but there's still a lot more to be done. And my vision for tobacco control in Africa is to have a strong and vibrant tobacco control community composed of civil society and government officials passionate about preventing the next generation of young Africans from consuming a product that kills half of its users. I would like to see adequately funded tobacco control in Africa. Ultimately, I would like to see stronger and stricter tobacco control measures in all countries so that eventually we can have a tobacco-free Africa.
Hi, my name is Sophie. I serve as Associate Director for the Africa Tobacco Control Advocacy Program at the Campaign for Tobacco-Free Kids. Having worked extensively with local partners on policy campaigns, my vision for tobacco control in Africa is that African governments recognize the NCD and disability burden as major threats to population health due to tobacco use as a risk factor and demonstrate political leadership by adopting tax and price increase measures and a total ban on tobacco advertising, promotion, and sponsorship to protect the youth from tobacco marketing.
Zanele from South Africa. In transforming Africa into a developmental and sustainable continent, amongst others, I think we do need robust and targeted tobacco control programs and policies in our region, Africa. In this regard, therefore, my vision is that by 2030, all countries in our continent, Africa, would have developed and would be in the process of implementing strong tobacco control laws that aim to promote and protect the health, economies, and environments from the onslaught by the tobacco industry.